Hello and welcome again. And we're still on Chapter 1. This is the second section of that, where we're going to look at survey of the human body. So the first thing we always talk about in courses like these are levels of organization. So really, here's an organism, a full organism, and I can take you down to the different systems that make up that organism, or more specifically, each organ that makes up some of those systems, or the tissues that make up the organ. There's many tissues make up an organ, many organs can make up a system, and so on and so forth. And we go getting smaller and smaller until we get down here to the atom, so which is non-living. So for us to begin looking at where in this sequence is it a living thing, it's actually the cell here. Okay, so in a course like this, you know that we're going to look at what goes on in an organism. You know we're going to look at systems. That's how your book is organized, by systems. And we start out our lab talking about tissues. So we're talking about tissues and organs and cells. But do we, in a class like this, do we actually go down to little organs, organelles? Do we go down to the molecular level at all? And the answer is yes, sometimes. So for example, in the chapter of muscles for sure, and others less so. But when we want to talk about how it is that muscle contracts, we're going to have to go down to pretty tiny here, down into molecules. And also that also goes for bones. So these are the different levels. And as I said, we'll be starting with tissues right away in lab this first week, and go to a cell chapter later on in the semester. But we'll go through all this and be there soon. The first very important lesson that you learn in a course like anatomy is that we can't use vague terms. You can't use a term where makes you uncertain as to what part of the body you mean. So if I was to say Tony Rubio has a tumor above the stomach, where's that? Where's above? Above could be different if he was lying down, or if he was standing up, or if he was on his belly. Then that above gets very confusing, and that becomes vague, and that is what we don't want in medicine. So we have to learn how to be very, very specific. This is again showing you someone who's lying down, and this section here would be above a lower section, whereas when you're standing up, above is up here and below is down here. So very, very confusing. So in order to do away with that confusion, we came across, not we, somebody did, came across the concept of anatomical position. If we were to put every human or every patient in one exact position, and we always refer to the organ or the condition as if that person were always in that position, then we're never going to go wrong. So that position is anatomical position. It's shown here two different ways, drawing and in a true human, where you're standing up, not sitting down, you're facing us here, and look, your thumbs are out, so your palms are interior. That is your anatomical position. So when something is described, a tumor is described, some condition that you need to highlight, it's going to be assuming that you are in that position, and that way it'll never be confusing. Good. So notice that the position of the arms. The position of the arms is such that they are supinated. So this is, I'm going to put the S here for supinated. Arms forward, let me stand up like this, right? And pronated if you are in this position like this. And it's so interesting because when your arm is pronated, when you pronate your arm, it turns out that those two bones rotate over each other. So it's a better position when it's unrotated. That's the one you want. We had a TA that would get confused with the supinated and pronated. So he always said, well, supinated, you can hold a soup. And pronated is the other way. So supinate and pronate. So whatever helps you remember all these terms. That is the position for anatomical position. So what you'll be looking at this week is are directional terms. And what we mean here is, what do you mean when you're saying it's to the outside of the body? What do you mean when you're saying it's to the bottom part of the body or to the top part of the body? So the series of terms that I'm having you look at already as your first homework and assignment has to do with those directional terms. And some examples here, they're all in table 1.1 in your text, and they go something like this. You know, what is ventral and what is dorsal in the organism? What is superior, above, and inferior, below? So in these, ventral is towards the belly and dorsal is towards the back. So I'm not going to go over all these terms because I want you to sit with them and go through them, but I'm just going to list a few. You have anterior and posterior and medial towards the midline and lateral away from the midline. Cephalic and caudal, cephalic towards the head and caudal towards the tail. And then proximal and distal have to do with these appendages that we have, like arms and legs. And if you are trying to refer to whether it's closer to the insertion or farther away from the insertion is where it attaches to the body, then it's going to be proximal, closer to the insertion to the body, and distal, farther away from where that appendage inserts onto the body. So make a list of these and learn these. You have some assignments, as I said, that you have to look at. Interesting that it has to work for other organisms, and that's why for a dog, for example, anterior and ventral are not the same. For us, if it's anterior or towards the belly, it's the same. But obviously, if you're on fours, like an animal is, it's not the same. So we need those terms in veterinary medicine to also work for an animal on all fours. What comes next are the body regions, and in the body regions, many of these you might know right off the bat, and then others that are unknown to you. So you'll have to spend some time with those. So if you get axillary, for example, it's the region of the axilla, right? Under your arm is the region of the axilla. Femoral, the region of the femur, so up by the thigh. And like that, you will have to go through all of these and make a list and know these. You really do need to know these. What are some of the complicated ones? Look, this one. Popliteal. That's probably one that you don't use in your everyday language, right? Popliteal is the back of the knee. So think of that. You have to say the back of the knee. That's 5 words. Popliteal just solves that problem down to 1 word. So for the others here, I'm going to have you just look them up. They are all in one big table in your book, and that's how you'll be able to study. The other section you have to study has to do with the abdominopelvic regions of the body. So if we were to cut this into 9 regions, this is a big area. Okay, and because it's a big area, we want to be more specific. And we want to be able to say, well, is it the area here around the stomach? Is it the area here under the ribs? Is it the area here around your navel? So there are specific terms that are going to tell you which one of those quadrants there we're referring to. Okay, so umbilical, and then hypo, this word, hypo below. Chondriac, chondrous means cartilage, so under the ribs or under the cartilage of the ribs here would be hypochondriac. And now an important thing is that which is right and which is left. So always we're talking about the right of the patient, not your right. Doesn't make any sense. It's the patient that matters, right? So it's their right and their left. So this, for example, would be the right hypochondriac region. It's the region under the chondrus or the cartilage of the ribs. This is all solved for you. There's that right hypochondriac. That word you might recognize from someone who's always complaining and thinking that they're always sick is a hypochondriac. And there is a fable that goes, I'm not sure if it's real or not, that's why I'm calling it a fable. It says that individuals that had gallbladder issues, and they usually had pain on this right side here. And that gallbladder pain that was around here would come and go. And so one day they'd be fine, and they said, no, I'm fine. And the next day they'd be sick, and they say, you're just a hypochondriac, you're making this up. And it's real. It's real that this pain comes and goes depending on the stones that you have in the gallbladder. So they were called hypochondriacs because of the pain in that particular region. So epigastric, gastric stomach, around the stomach, left under the ribs, left hypo, under chondriac. Umbilical, we got that one as close to the navel. Right lumbar and left lumbar, lower back. And then iliac, we'll see the bones that are here later on, the iliac bone, and it'll make more sense to you. And left iliac, which are part of the hip bone. So that's where that name iliac comes from the bone of the hip. And then below gastric. So epi around the stomach, below the stomach, and in between was the umbilical. So these again are in your book. These you'll be learning. Good. Another important vocabulary has to do with the planes that we slice something, and it's not just the entire human, but the plane. We have an organ that we're going to slice also. Here I have an organ, a heart. Okay, and when they take a cut out of it, you want to know, well, I don't understand how you cut it. Did you cut it from front to back? Did you cut it from side to side? So you want to be able to have that vocabulary. You want to understand that vocabulary. So let's start from this side because this is easier. So the frontal plane is if something is slicing me from head down to toe, but it's leaving a front on me. So slicing down like this, and I have a front plane and a back plane essentially. So that one's called the frontal plane that you slice something. Horizontal is if you just come along the hips here. Horizontal plane. And then the third one is the sagittal. So here again, we're slicing from head down to toe, but here we're dividing it right to left, and that is the sagittal plane. So we did sagittal, horizontal, right across the middle, and frontal, allowing the front to be separated from the back. Those are the planes. Another piece of advice is learning to break down the words, if you possibly can. We have this little dictionary, which is really excellent, and we usually keep it in the lab during our in-person semesters. It's a dictionary of word roots, and it's really helpful when you're trying to decipher what a word means, especially if they get long, like gastroenterology, right? You want to break it down into its little pieces. What's that mean? Gastro, entero, and ology, right? Or logy. So gastro, stomach, entero, small intestine, And logy or ology is the study of. So there you have the study of both stomach and small intestine, gastroenterology. Like that, it's so helpful to break them down because you're going to have muscles that have these complex names. And if you can break them down, it's going to make life easier. Let me give you another example. Hyponatremia. You have no clue what that is, let's say. And you decide, well, maybe I can break this down into its component parts here. So hypo is below normal, under. Natrum is sodium. And emia is blood condition. So you have a below normal sodium condition in the blood. Hyponatremia, low sodium. And like that, you have epigastric, hypogastric, endogastric. And all this again is just, I'm just trying to tell you that once you start seeing the origin of all these words, it's going to help you tremendously. So epigastric above the stomach, hypogastric is below, and endogastric is within. Okay, bits of wisdom here. In the regular semester, I have some clickers. We won't be doing that this semester a bit. I left them in for this very first week. After that, I've removed everything. So if you had to state the directional term, and you haven't studied these, I'm assuming, yet, but you might know some of them, state the directional term that describes the eyes relative to the nose. So we're comparing, you know, where is the location of the eyes relative to the nose? So take a minute to look at that. And the answer is lateral, right? The eyes are lateral to the nose. Okay, and this is an older version of the text that I have here. We have, remember, the newer version is the one that has the eye on it. If you have an older version, you will need to purchase Connect separately because you will need that also. So if someone gave you the book, then you don't have to buy it, but you would have to buy the attachment, which is for Connect, which is the online portion. Okay, another clicker. This is a yet older edition. That's the 4th edition. State the directional term that describes the knee relative to the heel. Take a minute to do that. And the answer is proximal. So knee is proximal to the heel because it's closer to the place, the attachment of the leg here, right, to where the leg attaches. The knee is closer to that than the heel is. So it is proximal. There's our text. State the directional term that describes the skin relative to the muscles. We didn't talk about that one. So when you have layers, you want to be able to say, well, where is it in the layers? Is it top layer or the middle layer or the bottom layer? So the term there is superficial, right? The skin is superficial instead of, the opposite of superficial is deep. So deep or superficial. And that's how you can compare layers. Sometimes I'll have questions that say, and this always confuses people, which is incorrect. So which of these would be incorrect? An individual has appendicitis. We say that the appendix is what? I'll give you a minute. So, which is incorrect? Okay, lateral to the hip bone. Nothing can be lateral to the hip bone because it'd be outside of your body. So lateral is further away from the midline. So that wouldn't work. Well, I like this one. Spider-Man. So here's Spider-Man. He's the patient. And in this patient, the nose is what to the foot? This is definitely a trick question. And the answer is, in this patient, the nose is superior to the foot. Why is it not inferior? Because I don't care what position the patient is in. You have to always refer to the anatomical position. Remember, of standing up with your arms supinated. So it doesn't matter what position Spider-Man is in. Still, his nose is still superior to his foot. I hope I didn't trick you. Okay, here we're slicing a carrot. We could be slicing anything. What plane are we slicing it in when we slice the carrot like that? Transverse is the correct, because we assume that this is the top of the carrot, the carrot, and we're cutting crosswise, so that is a transverse plane. Okay, if I use an eggplant, and then I ask you there, what plane is this sliced in? Because we still have a head. Right, we're going to call that the head. What plane? You can't tell. You can't tell. It could be sagittal or frontal because it doesn't have a left or a right, correct? And if it doesn't, you just rotate it and there's no way of knowing. Tricked you again. So in this case, you wouldn't be able to say. But in this case, we should be able to say, what kind of plane is this slice happening in? Sagittal. And that was that. That was the last slide. So I think you know what you're doing now. And thanks for listening. We're off to a good start. Thank you guys. Bye for now.